The hardest part in the beginning was the unknown.
We were taken by storm, for sure.
The world was looking at us to help them through.
We were all scared, but we were all ready to work hard and work together to do what we needed to do.
In 2020, the world seemed to stop spinning. The global pandemic known as COVID-19 hit hard. Businesses closed, theaters went dark, and healthcare workers were thrust into the spotlight, with HCA Healthcare center stage.
People really realized that healthcare providers had an even more important role than they did before.
The world was certainly depending on HCA Healthcare to be there, available throughout this pandemic.
During the pandemic, we remained committed to doing what's right for our people, our patients, and our communities, even in the toughest of circumstances. The world reeled, but HCA Healthcare rallied quickly, installing new practices and new protocols to ensure our commitment to care would not suffer.
We're trying to gather as much information possible and learn from every other country. Luckily, technology allows us to have meetings and to hear from people in Italy and Spain about what they were learning and what their experience was, so we could apply it here to our patients as we started to see a case every day.
We became a team. We became a team with the doctors. We became a team with respiratory therapists.
We started helping the development of protocols. There was an aspect of the testing and getting the results to confirm or not, and the delay on the testing at the beginning. There was the aspects of, isolation and creating special units.
We were uniquely positioned to help not only our own patients, but an entire nation desperate for relief.
It's not just one hospital. It's not just one division. It's not just one region. It was HCA Healthcare coming together from all across the country.
Because we are part of a huge family within HCA Healthcare, we have scale.
As an organization, our size and scale really was a strength for us. Being able to take from one part of the country to the other, whether that be expertise or equipment or resources or people, I think was really highlighted through the pandemic.
A network of different components that are important in terms of fighting this pandemic, from just supply chains to personnel to protocols to availability of drugs.
HCA Healthcare always made sure we had what we needed to fight this COVID-19 pandemic.
We were given everything that we needed to ensure our safety along with the safety of our patients.
In 2020, we distributed nearly 1.2 billion pieces of personal protective equipment to ensure our colleagues were able to safely care for their patients.
It feels good knowing that they'll go into the room comfortably and safely because we provided the proper PPE for them.
We partnered with the federal government, playing a lead role in the dynamic ventilator reserve. And we expanded remote workforce and telehealth capabilities.
Within just a couple weeks, our office was able to provide telehealth visits for our patients. These telehealth visits have really allowed the patients to feel like they're taken care of just the same as they would be if they were in the office, but in the safety of their own home.
We also shared our unequal data reserves with organizations like Google Cloud and SADA, and led the way in clinical trials for COVID-19 research. As part of our learning health system, 175 HCA Healthcare hospitals participated in a national COVID-19 convalescent plasma study. We formed a consortium of prominent public, private, and academic research institutions to use our vast data on COVID-19 hospital care to improve patient outcomes and public knowledge.
Our corporate clinical team was reviewing and combing through all the latest and greatest research that was becoming available and helping supply us with information and guidance on how to best treat our patients.
From the onset of the outbreak, HCA Healthcare has made our impact felt in the fight against COVID through world-class care and community support. By the end of 2020, we treated over 122,000 COVID-19 inpatients, more than any other health system in the country. We also provided more than $45 million to community organizations. Our HCA Healthcare Hope Fund distributed a record $10.6 million in assistance to nearly 5,000 HCA Healthcare colleagues. And our pandemic pay program ensured over 127,000 colleagues were able to continue to support themselves and their families. But the work is not done. We will continue to restore the health and well-being of our communities, offering the hope of a healthier tomorrow through the distribution of vaccines.
The COVID-19 pandemic has reinforced our mission. Above all else, we are committed to the care and improvement of human life. I believe that now more than ever before.
The pandemic has been a crisis like no other, but we are a healthcare company like no other. So even amidst these historic challenges, we will prevail, fulfilling our promise to improve more lives in more ways.